Stay tuned for Street Beat, Classic Hits public affairs and information program. Views and opinions expressed are not necessarily those of Classic Hits Radio's management or staff.
And good morning, it's Lupe, Classic Hits, 92.7, 95.3, a breakthrough that's changing lives and knees in Down East Maine. Calais Community Hospital is now the first in the state to offer smart knee technology for total knee replacements. And the surgeon leading the high-tech charge, Dr. Wendy Crawford, joins us on the Street Beat to talk about it. Good morning, Dr. Crawford.
Good morning.
Oh, let's turn up your mic. How about that?
That actually could protect
radio.
me from saying something I didn't want to say.
All right.
Good morning.
So Persona IQ Smart Knee. What makes the Persona IQ Smart Knee different from traditional implants, and why is this a game changer for rural patients?
Big question right at the get-go. All right, so Persona knee implant isn't new. We've been using the Persona knee, like I've been using it for at least, I think about 8 years.
Okay.
So that's the implant. That's the two metal implants and the little plastic piece that goes between them. But what Zimmer did, which is the company that manufactures the Persona knee, is they came up with a little device that's attached to the implant, and it's a little computer chip. And that's what makes it, quote, smart. And so that's been around for about 3 years, I'd say. There's about 60,000 of them already implanted across the United States. But nobody in Maine really picked up on it and said, geez, we have a need for that. So I was at the National Convention in February, and the way that it integrates with an online app and the Smart Knee really was something that I saw, and I said, rural Maine needs this. And it would make delivering good quality outcomes to the patients a lot easier for the limitations we have in this area.
Now, can you walk us through what data the Smart Knee captures and how that information helps guide recovery?
Yes. Okay, so that's the exciting part. And this is the part that I saw when I was at the National Convention. I was like, this is amazing. So with this little chip, it's a computer chip that goes on the tip of the tibial implant. That's the leg bone. And so then you have a little bedside home base, it's called. And it works a lot like some people have different types of pacemaker defibrillators for cardiac conditions, and they have a home base. And at night you go to bed, and via Bluetooth technology, it downloads the information. That information gets sent to a cardiology office. So this sort of application has been in use for years. My dad even had one starting like probably 7 years ago. So they extended this now to the knee implants. So what it does is it captures range of motion, so that's how much you straighten and bend your knee. It captures how many steps you take a day. It captures the cadence or the speed that you're walking and the quality of those steps, like the size of the pace, for example. And then that information gets downloaded into this home base every day. So then in the morning when the patient wakes up, they can look at their phone, at their app, and see how they did that day before. And it also puts it on a graph that helps them to see, are they within the norm? Are they falling behind? Or are they pushing it too hard? And then that information also gets sent to me at our office. And so I can see it. And so as we track it, it gives us an idea, how is their therapy going? Now, when you combine the smart implant with the My Mobility that Zimmer developed, which is the app, the My Mobility has, on a daily basis, exercises 3 times a day, and you just click it on. They're called activity wheels and education wheels. And so they can do their physical therapy from home, and it's guided. Now, it doesn't take the physical therapist out altogether, because some people aren't self-motivated, so if they want to go to therapy, they can.
So when you're looking at the app, can you say, get on there and say, hey, get to work?
I actually can.
Okay.
And I have, and it's not so much, hey, get to work. It's more like, is something going on?
Okay.
So I did have a patient, I've done 4 of them, and one patient I noticed the activity, the quality of the range of motion was still there, the steps were still there, but the amount of activity that this particular patient was doing decreased. So I did reach out, and I was like, are you having a problem with the app? Are you having a problem, with something? And she wrote back, yeah, I'm actually having a lot of pain, and I can't get my pain meds refilled. And that was an issue with the prescription that I didn't know about. So that's the second part that I love about the My Mobility app, is there is a conversation piece, so they can just directly message through that app. And so we get those messages directly at the office, and I get them on my app on my phone as well. And so we can respond like with live time chat like you do when you talk with
Facebook?
Amazon or Facebook. Exactly,
Yep.
all of that.
Yep.
And so it was great because I didn't know I put the refill prescription in, didn't know she was having an issue with it. And it was only because I reached out to her to say, hey, I noticed you haven't been as active the last couple days.
Yeah.
She's like, boy, lots of swelling and pain. Yeah. So we're trying to alleviate
It makes
follow-up.
makes them easier to tell you what's going on.
Absolutely,
They
because
might-
it's in the moment,
Yeah.
right? If they're coming for a follow-up at 3 weeks post-op, for example, a lot of times patients, they don't want to bother what they think is a very busy office, right? And so they'll hold on to stuff and they'll write it down, and then they might wait 3 weeks to tell me about something. And this allows us to address it in the moment, which is, it's just, I feel myself, much better quality of care. And the other thing that's kind of nice is a lot of people, not even just rural areas, but especially rural areas, have a hard time getting to and from physical therapy. It might be a 45-minute drive.
Yeah.
And then financially, it might be a $20 or $30 copay every time you go. And so it can be a burden. Also, if you factor in the cost of gas getting to and from physical therapy. So when you can give a patient an option of doing good quality care from home that can be overseen, then it's really given a lot of advantage to some patients that live especially rural. It was interesting at the national meeting too. We learned that it wasn't a unique problem to just rural areas as far as access to care. It's actually within cities too. When I was practicing in Presque Isle, Maine, post-operatively we would use home health for the first, say, 2 to 4 weeks to kind of cover the gap when they couldn't get to physical therapy. Well, here in Washington County, it's really hard to access home health because it's so limited and there's such a demand for it that I wasn't able to utilize acute home health, for that 2-week post-op period. It just didn't exist. So I would try to give them education. The physical therapists that work at Calais Community Hospital, awesome, and they would try to give education as well. And they'd go home with the exercises, the paper and everything, but there was no way to monitor it. So adding this in has really bridged that gap. Yeah.
And how did you push for it? Like, you just went after it?
Yeah, so it wasn't hard. That's one of the nice things about working in a small community hospital, is that the administration also sees, when you present something to them, they can see, oh, that's the need. Yeah, we know that need. See, they track backlogs and appointments, and they can see, like, physical therapy, for example, here is backed up because there's such a need for it. So when I would bring this, to our administration and said, hey, here's the need that this is going to fill, and then they took time to work with the company to do the cost analysis to say, okay, how much more is this? What is that cost factor? And then was very short, came back and said, yeah, let's move forward with this. It was awesome. It was very exciting, actually. And that's one of the major reasons that I love working in small hospitals. It's just, you can be so directly linked to the administration. You don't
decision
have to.
makers.
Yeah, it's just so quick and personal.
Nice. So looking ahead, how do you see smart implants like this evolving, and what excites you most about the next chapter of orthopedic care?
So already on the forefront. So we didn't actually talk today, but about Rosa. So Rosa's the robotic assistant that I use. So it's an assistant. In general surgery, they have a robot, but the robot does the surgery while the general surgeon sits in the corner and runs it. So it's like virtual. Rosa's not like that. Rosa is like, imagine the most accurate measurement tool. And I use it just like I would a level or a ruler. So I have to hold it, put it on the, the surgical field. And so I have to be there.
Okay.
But I'm actually making the cuts and things like that. Well, Rosa right now works very well for hips, hip replacements, and knee replacements. She's not yet ready for shoulder replacements, but we are within months. And so I'm so excited because right now I'm using guides that are called patient-specific guides that are based off of a 3D printed model. Still very advanced, pretty cool too. But it will move to where I can use Rosa for shoulders. So that's right there, live time, capturing, the
Wow.
patient's personal anatomy. So
Man,
that's
there's so much to talk about with this.
so much.
Unfortunately, we don't have a lot of time.
No,
but,
that's okay.
But so how do people get started if they're listening and they want to explore the procedure?
So it's pretty easy. Just basically a referral to me. We get them, start with an x-ray, see if they're a candidate for knee replacement. There's a lot of stuff you can do before you even get to the surgical point. There's a lot of non-operative treatment. And then if they, qualify, then we just move forward. It's actually not very hard at all.
Nice.
Yeah.
Is there anything else you want to add? What about wait times and things like that? I didn't get to ask that question.
Right now, we're booking out about 6 weeks. 6 to 8 weeks is about where we are now. So the wait time is actually not. I know that some other areas close by, like within an hour and a half to 2 hours, their wait time is like 6 months. So we're down around 2 months. So
okay, all right.
Yeah.
Sounds good. Dr. Wendy Crawford, Calais Community Hospital, thank you for joining us.
Thank you, Lupe.
And this is Lupe. You're listening to Classic Hits, 92.7, 95.3. Thanks for listening.
This has been Street Beat, Classic Hits public affairs and information program. Views and opinions expressed are not necessarily those of Classic Hits Radio's management or staff.